let's say for someone who's starting their third year out, what should we say? Like, I think we've kind of answered this a little bit, but like, what should be their process? Let's say they're just trying to survive their first rotation right now. I think what's like, obviously we said like pay attention to what the, people are doing, talk to people. I guess, is there anything else someone like in that position should be doing that you think?
Yeah. I would say try to envision yourself um, doing whatever rotation that you're on. Try to envision yourself doing that for the rest of your life.
Mm-hmm.
Um, I remember being a third year and going into certain rotations and knowing right off the bat that I didn't want to do that. For example, let's say pediatrics. I knew I didn't want to work with children, but I tried to make it a point to help, like, envision myself doing that. So I think if you're stuck in a position where you're sort of unclear what you want to do, I think that's a good way to really tease out whether or not that's something you can see yourself doing for the rest of your life. Being a third year is tough. You're going to do a lot of things that you don't like to do. But having those conversations, really getting immersed, going in early, leaving late, I think those things will really give yourself the best chance at analyzing whether or not you feel like you can pursue said career for the rest of your life.
Mm-hmm. Yeah, and I think that's true. I think also paying attention to I think each field, you hear this a lot, has its own personality or attracts its own personality. Obviously, there's wide varieties, and I don't mean just generalizations like, arrogant. There's arrogant physicians in every, there's family practice physicians that are very arrogant, And then, I mean, one of the coolest attendings I ever worked with was a neurosurgeon. I mean, because usually they think they're, so I think that being said, every specialty, like we've kind of talked about, has its own speed. I mean, you look at like emergency medicine. If you're not into like adrenaline, those guys like the adrenaline rush. They like things moving fast pace. They like thinking on their feet. If you're one of those versus like internal medicine is a very different, you have a little more time to process. Obviously you do have situations where you do have to think on your feet, but it's not as like all the time as emergency medicine. So I think kind of figuring out what your speed is, what your personality is. Do you like fast paced? Do you like short paced, or slower paced, things like that? And again, really picture yourself doing this for the rest of your life. I mean, for me, that was one thing with, surgery. I was really interested in fields such as like orthopedics, neurosurgery, surgical oncology. I just didn't want to be getting called in for this kind of stuff. I was not a big fan of like some of the trauma stuff. Like, I think it's cool. I respect that. But I think at the same time, it was, to me, at least, it was some of the the less interesting things versus some of the other procedures that those fields did. Versus interventional, I think the emergencies are very cool. I mean, embolizations and things like that. And again, the interventional mindset's a little bit more, it's a little bit slower of a speed, or not slower of a speed, but it's a little bit more of, I guess, a lifestyle friendly speed, which, it allows you to, where you're not on, if you're in a big enough group, you're not on call all the time. And I think the stuff when you do get called in, most interventional radiologists, they like that kind of stuff. They like those type of procedures that they get called in for. And so that was, again, kind of contributing to my switch as well. And things to think about, and, it's almost the diagnostic versus interventional route as well. Interventional is a little more like surgery, fast paced, versus diagnostic, kind of a little bit more like internal medicine. You got, you sit there with your coffee and you kind of, think about things a little bit. I mean, obviously you don't want to be too slow, but like, it's the same kind of thing. And I think you made a good point. Do you like working with kids? But yeah, I think, I think from kids is there's a lot more involved there. There's, the parent situation, there's, I think the fact that it's a child can make it a little bit more, turn the pressure a little bit more up, versus, obviously every life is equal, but, it's a lot harder to lose like a 10-year-old kid than it is like a 95-year-old who's lived a full life. So I think
that's right.
Those types of situations, are you into that, or, which type of patient population do you want to work with? Things like that. So.
Yeah. And then, To add on to that, I think the clinical setting that you'll ultimately be working in is also important to explore. Do you like being in the clinic? Do you not like being in the clinic? Do you like working in the hospital setting? Do you like working in the private practice setting? So I think that's oftentimes overlooked, when you're a medical student. But they're all things that eventually, once you get to the resident level, once you get to the attending level, will have to be looked closely at.
Yeah. And I think as you go through your third year, another thing to pay attention to is, do you find yourself thinking about it when you go home at night? Like I remember
Mm-hmm.
like OB-GYN, it was just, I have a lot of respect for what they did, or what
Mm-hmm.
they do as a specialty. It's obviously, all of us came into this world in this day and age because of an OB-GYN, but it just was
Mm-hmm.
not for me. And so I didn't find myself thinking about it. When I went home, I checked out and, didn't
Mm-hmm.
think as much about, I obviously studied for the shelf, but otherwise I didn't think much. But like with other specialties that I was interested in,
Mm-hmm.
like I would read about it, like when I was, when
Mm-hmm.
I would read about it at home, I would read about the case that we had done that day or the case that was going to come up the next day. If you find yourself going that without even really making yourself go that extra mile, just because you're curious, you're interested, I think those are all
Mm-hmm.
positive signs. If you find yourself looking into a certain type of disease you saw that day or a presentation you saw, if your attending asks you to teach about something the next day and you're actually are excited about it, you're not looking like, oh shit,
Mm-hmm.
this is like one more thing I got to do. But if you look at it
Mm-hmm.
instead, if you're looking at it instead, like, wow, I'm really excited to learn about this, teach the team about it the next day.
Mm-hmm.
I think those are all really positive signs you should pay attention to. That
Yeah.
maybe this is for you. Maybe this is what you really like doing.
Yeah. Yeah. And I think analyzing the types of people that you're working with while you're on the rotation is also important.
Mm-hmm.
If you're getting along with the residents, when you have a little bit of downtime, try to see if you can see yourself working with people like that. But at the same token, I think if you don't get along with a certain attending, if you don't get along with a certain resident, don't let that discourage you either from pursuing a certain specialty. Because in every field that you pursue, there are going to be people you like and don't like. And that's just the reality of being a professional. But when you do become a resident, you're going to be spending a lot of time with those people. They will become your family, whether you like them or not. So, I think, trying to immerse yourself as a medical student amongst the residents and even your fellow medical students is a really important thing to do.
Yeah, definitely. I think personalities. I think your mentors. I think finding good mentors early on. And it doesn't
Mm-hmm.
necessarily have to be in the field. Like I said, one of the coolest attendings I worked with was a neurosurgeon
Mm-hmm.
in medical school at Toledo, and he really wanted me to do neurosurgery. And neurosurgery was a field I really considered seriously. But again, just like the trauma aspect of it and some of the other, neurosurgery is one of those fields that runs your life, even as an attending. Like obviously you can get certain jobs in certain settings, but to do neurosurgery right, it's got to be a huge chunk of your life. And I wasn't sure I wanted,
Mm-hmm.
I had other interests. I liked doing research. I liked entrepreneurship. I liked, obviously I like doing things outside the hospital as well. So I wasn't sure I wanted to commit that much of my life to just one aspect of my career. And he was okay with that. He respected that. And I think, if they're a good mentor, they'll respect that. A truly
Mm-hmm.
good mentor will respect that. And I think as med students, we'll want to try to emulate our heroes or our mentors.
Mm-hmm.
And I think, it's good to be interested in a field with someone you like, but I think don't feel obligated. Even if someone's done some things to help you, they wrote a letter for
Mm-hmm.
you to get some kind of research grant, or they, helped you get into an elective rotation or something like that, or anything, or let you do a lot in the OR, or do a lot on the floor, or anything like that. I think that's just them being a good mentor and being a good teacher. I
Mm-hmm.
wouldn't necessarily feel obligated to go, because again, this is the rest of your life, and again,
Mm-hmm.
kind of going what I was on earlier, you're going to make your decision, you're going to go your way, and at the end of the day, that person, they're going to go on with their life, whether you're doing what they do or not, it doesn't really matter. So I think remembering that, you know, you almost have to be a little bit selfish. You know, you have to think, this is my life. This is what I'm going to do. And I think, you know, like all the things we're talking about, making sure it fits with you.